Don't let this happen to you. In today's video, I'm going to teach you what might be the most important movement that we teach our patients here in the clinic. It's a movement that's going to spare your back from all that unnecessary wear and tear. I'm Sam Schroetke, Doctor of Physical Therapy at Physical Therapy and Hand Clinic of Hillsboro. Today, I'm going to show you the hip hinge. And this is super important because it helps us protect our back while we're lifting things off of the floor, even heavy things. There are 4 key things that we need to keep in mind when we're lifting things up off of the floor. Here's what not to do. Arms too far away from load. Number 1, you want to make sure that you get close to the object, as close to the object as you can. So you actually want to get right over the top of it if possible. And I'm actually straddling this. I'm getting my center of mass, my center of gravity, right over the object. I'm not out here. That's going to hurt your back. You can't do that. All right? So get as close to the object as you can. Get right over the top of the object. That's 1. Rounding the low back. 2. Back will stay straight. This is where the hip hinge comes into play. I don't have to remain upright. I'm going to bend at the hips. My butt goes backward. All right? But see, my back is still flat. Here's what I'm going to do. I'm going to take the dowel, broomstick if you want. It's going to be maintaining contact with the back of my head, right between my shoulder blades and my tailbone. Not your butt, because your butt's going to go backward. Okay? So maintain contact there. I'm going to have a chair behind me. I'm going to hinge at the hips and push my butt backward, touching the chair. So now you see my back is still flat. I haven't done this. This is what we're trying to avoid. Okay? And we avoid that by maintaining a flat back and bending at the hips, hinging at the hips. My butt goes backward trying to touch that chair. You see? Move your butt, slide it backward. Move from there first. Butt goes backward. Butt goes backward. Touch your butt to that chair. You've got to groove that pattern. That's going to prevent this from happening. 2 things so far. We get as close as we can to the object, straddling it if possible. So I've got a wide base of support. I'm not narrow here. Wide base of support. I'm right over the object. My back stays flat as I go down toward the object. I'm as close as I can to this object. Knees going over your toes. One of the other mistakes we see made is they say you have to stay upright. That's not the case. That's keeping your back vertical and straight, but that's hard on your knees, see, because that causes your knees to bend over your toes. And that's really requiring a lot of motion here, but it's also stressful to the knees. And then you're lifting with your quadricep muscles, which are not as strong as your hip muscles. We want to load our hip muscles. So again, 3 things so far. Get as close as you can. Back stays flat but not vertical, and come down to the object. There you are here. Shimmy my arms underneath. I'm as close as I can get to it, and then I lift with my hips. Lift with your hips. Lift with your hips. Twisting your back with the load. Lastly, the 4th thing is, once you have the object lifted, if you have to transport it somewhere, put it on top of something. If you're loading something onto, say, a pallet or a shelf, don't twist from your back. That's bad news. You're asking for trouble. When we move, if we have to turn, we're pivoting. Our feet move. We're keeping our shoulders lined up over our hips. They don't become disconnected. See that? If I'm twisting with my shoulders not in harmony with my hips, that's putting a lot of strain on your back and your low back structures. So once I'm up with the object, keeping it as close into me as I can, pivot from your hips and your shoulders. See, my hips and shoulders are staying square, and then from there you're putting it down onto something. These 4 things are going to save your back, especially if you have to lift something heavy and or relatively heavy things over and over and over. Come over the object, straddling it if possible. Keep the back flat, but not vertical. Hinge at the hips. Down we go. We shimmy our arms underneath if we can. Keep these elbows in tight to your body. Lift with your hips. And then if you have to transport it somewhere, when you're turning, pivot your feet so that your hips and your shoulders stay square. Hips and shoulders need to stay square. The other protective measure you can do once you've mastered this hip hinge and lifting things up properly is make sure to do either extension and lying, which I've showed in a previous video, or extension and standing, and that's going to offset all the bending you are likely having to do. So all that strain kind of gets reset if you do these extension-based exercises, and I'll post those links in the video. I'm Sam Schroetke here, Doctor of Physical Therapy at Physical Therapy and Hand Clinic of Hillsboro. Thank you for watching the video. If you like what you've seen, subscribe to our YouTube channel, click on the little bell so that you'll be notified each time we upload a new video, like the video, share the video with your friends, and make sure to leave comments below. Let us know if you've tried this technique and how it's worked for you, if it's helped or if it's not, or if you have questions, we will get back to you.